Hello. Good morning, Dr. Sunaina, Dr. Ruchi. This is Upinder this side.
गुड मॉर्निंग उपिंदर।
How are you,
Good
ma'am?
morning.
मैं बहुत ठीक हूँ।
So we are all
Good
set to
morning.
start. So we'll start at exact 11:30 because for our live streaming, we've given time for 11:30. So
Yeah.
we'll start at 11:30. Would that be good?
Yeah, I am ready.
Okay. Thank you. Thank you so much.
हाय डॉक्टर रुचि।
Hi, Dr. Sanana. How are you?
मैं बहुत बढ़िया हूँ, आप कैसे हैं?
मैं भी बिल्कुल बढ़िया हूँ.
हम कहीं एटलीस्ट जूम पे ही मिल लिया है ना।
I know. नहीं वैसे भी मिल लेंगे, कोई प्रॉब्लम नहीं है. So you have left IB या जाते रहते हो आप बीच-बीच में?
जाती रहती हूँ अभी बीच बीच में, कुछ पुराने
Okay.
पेशेंट्स होते हैं, सो आई टेक देम आपको पता है।
Okay, okay, that's good, that's good. नहीं तो आपने घर पे शुरू किया हुआ है या अलग से क्लिनिक लिया है अभी?
इवनिंग में घर पे।
Okay, that's great. That's great. That is really great. Yeah. बढ़िया है. So how is your work going on?
बहुत बढ़िया चल रहा है। ऑब्स्टेट्रिक्स तो आपको पता ही है, सब इमरजेंसी एंड ऑल।
Yeah, I know. That is an important part, you know. You cannot avoid these things.
या
Yeah, I know. Difficult हो जाता है इन चीज को. You have to be fully covered, fully everything masked and everything. You have to do that
आई
thing.
टुक अप द मास्क एंड एवरीथिंग आफ्टर द
Yeah,
राउंड।
I know, it's difficult.
So I really don't want to interfere between the conversation.
Yeah, please,
I
please,
think
please, please. Yeah,
we're all set to
yeah,
start. So we
yeah.
have our audience watching us live on our Facebook pages and on our YouTube channel. So the way we're going to go through this webinar is we're going to have your individual presentations, and whatever the audience will have, the questions that are going to come on the live chat. And after every session, we'll take up some questions. And the end of the entire discussion, we can have the questions that are common for both of you. So we'll go that ways, right? So we'll formally start. So good morning, everyone. I'm Upinder Preet Kaur, and I'll be the moderator for today's discussion. And as we all know that, there's so many things around us that still needs to be spoken about, that still needs to be discussed about. And the topic that we are trying to cover today, they are usually taken as two different topics, but through this 1 hour session, we'll try to kind of, speak to the experts and try to find out the link between PCOS and depression among women. And as I said before, both these topics are those topics which are always shunned under the carpet. People don't talk about it, be it the women health and depression, both. And when both comes together, I think it becomes really important to openly talk about it, openly discuss the problems that, many of us are facing. So I personally feel, till the time we don't unwrap that black packet that we all get from the chemist shops about female hygiene and female menstrual problems and, the whole life cycle of it, and we don't start discussing about it openly, it's going to remain a social taboo for a very long time. So can we please move on to the next slide? Because I personally don't want to take much time. We have the experts who are going to talk about all this topic in depth. And I myself personally is looking forward to learn a lot of new things from this 1 hour, because this topic is something which is very new to me. Like I personally haven't much, read about it or kind of, researched about it. But somewhere, yes, I know that, it is important and we really need to start, talking about it and working towards it very effectively. So a little about our organization. Our organization, Generation Saviour Association, is a public health organization which is in existence since 1996. So it's 24 years that we've been working in the field of public health. The main areas that we generally focus on is preventive healthcare. So in that, our core area of working, the area from which our organization started is basically tobacco control. We started from this very city of Mohali, and now presently we are working in the state of Punjab, Haryana, and UT Chandigarh. And we have plans in also extending our tobacco control programs to other neighboring states like Jammu and Kashmir, Himachal, and Uttarakhand. Then the second area there where we have our youth intervention and school intervention programs running is on child obesity. The third area, which I think it is the need of the hour, is protecting present and future generations from non-communicable diseases. We have dedicated programs running in the government for NCDs. But still, as as masses, we still tend to kind of ignore the lifestyle diseases. And we have the two experts with us. They'll be better telling us that there's so many problems in our lifestyle because of which our healthcare, our preventive health is actually going down. And I think Dr. Sinena also kinds of promote all these lifestyle changes for a healthy lifestyle, and we would love to hear about that also, apart from the technical session that we have for this day. Whatever the public health challenges and threats comes in our way, we try to kind of cater it through our community level programs, and also supporting the governments in executing their public health programs effectively. Next, please. So yeah, as I said, that I'm no expert in this topic, but this was a topic that I was very eager to learn about. So I thought, why not organize, why not have a wider audience, and let's all of us learn together about this topic. But yeah, a little, what I read and what I heard in some other webinars that I attended, and which kind of drew my attention to this topic was, when we talk about PCOS, 20% of Indian women suffer from these problems. And still, as I said, that, they are not spoken about, they're not in the mainstream. Leave about mainstream, I think even women don't find it very comfortable in openly talking about their problems. And we all know that these problems, this problem makes women at a higher risk in developing many other types of NCDs like diabetes, high blood pressure, and other health complications. So yeah, this was some data that I could come across, and I would really want the doctors to kind of validate it, and help me learn better, and help all of us learn better today, that PCOS, when we talk about it, so it's not just related to one basic problem, how it kind of affects our entire body, starting from our head to the toe. And the link between PCOS and depression, I'm sure Dr. Ruchi would be, will be better in telling this thing. But I also personally feel that, when you're suffering from a problem about which you cannot talk about openly, about which they're not, still not that kind of a health infrastructure with kinds of support the support the issues arising out of those problems. So how that kinds of affects women more mentally. We all know that depression among women is 2 times more than in men. And also the relation between PCOS, because of the high prevalence of that into the Indian women, and how that leads to depression among women. And how this 5 crore number that are there, of people who suffer in our country due to depression, what is the amount of contribution does PCOS has to that? So, and also, one thing that kind of is at the core of our organization also, and which when we go about, and, when we meet so many people, we all know that, when it comes to preventive healthcare, and if we make a list of priority members in a family, the women's health come at the last. So when we talk about preventive healthcare, there'll be many of us who'll be privileged enough to have that kind of support and that kind of privileges, wherein we can afford and we can decide about our preventive healthcare. But more than majority of our population of females in our country doesn't even have access to basic preventive health care. Leave aside preventive healthcare, but a safe healthcare that kinds of affects them directly. So I think it would be great if the experts can also talk about that, how governments can come up strongly on this point, in how we can have our public health programs more focused towards the problems that we as women face. Next, please. So yeah, so as I said, this day is all about from listening from our experts. So without delaying it further, I would like to hand over the presentation to our first speaker, the first expert for today's session, Dr. Sunaina Bansal. Dr. Sunaina Bansal, she's a senior consultant practicing in the Tri-City from last 12 years. Presently, she is working with the Cloud9 Hospital, Chandigarh, and I personally have had a chance to meet her through her Cycle Giri initiative that she has started. She's the founder of the initiative Cycle Giri, and I'm sure she's going to talk about it. I would love if she talks about it. Her areas of expertise include high-risk pregnancy, infertility, gynecological cancers, and laparoscopic surgeries. And as I said at the starting, also she is a motivator and a great advocate towards fitness, and cycle being her favorite sport. So over to her, and looking forward for a great session, ma'am. Thank you so much. So over to Dr. Sunaina Bansal.
Thank you so much, Upinder, for the kind introduction. I hope I am audible.
Yes, ma'am.
Thank you, Upinder. And first of all, I would like to congratulate the entire team of Generation Saviors Association for taking up this initiative, uh, speaking about the mental health of women, especially in a disease like PCOD, which is so very common nowadays. As you said, 20%, and maybe many more women who are undiagnosed. So maybe the incidence is more than that. PCOD is such common. So, and today we have with us Dr. Ruchi also, who will speak on the mental health issues associated with PCOD. And I would like to start with some basic things about PCOD, what it is, what are the symptoms, how to treat it, and how to prevent it from occurring. So let's start with the presentation. And can I have the slides open there?
Slides are up there. Can
Uh,
you see them? I think you'll have to just
I can have a look. So yeah, thank you so much.
Yeah.
So what is polycystic ovary syndrome? PCOD is known as polycystic ovarian disease, or we also call it PCOS or polycystic ovarian syndrome. As the name indicates, it is a hormonal disorder in which there are polycysts in the ovaries, that is many cysts. If you can have a look at this picture, we can see a lot of fluid filled small balloon like bubble like cysts in the ovary. This is a cut section of the ovary. And the ovaries become like this when someone has a polycystic ovaries, lot of cysts inside the ovaries. Along with this, there are infrequent or prolonged menstrual periods and excess. There's an imbalance of hormones in which there is excess male hormone or the androgen levels, which are produced in the walls of these cysts. Next slide, please. PCOS is a health problem. How it affects women? It can affect not only their menstrual cycles, but their ability to have children. The hormones that are produced inside their body, they can also have a deteriorating effect on the woman's heart, blood vessels, and also leads to weight gain. Next slide, please. What are the main symptoms of polycystic ovarian syndrome? In some women, polycystic ovarian syndrome may not give rise to any symptoms. When the disease is mild, there are no symptoms at all. But then some of the symptoms might include infertility, like inability to get pregnant. That is because these ovaries which are having cysts, they are actually not producing eggs. So PCOS is the most common cause of female infertility nowadays. Next slide, please. Another symptom could be a disturbance of the menstrual periods. Now, menstrual periods might get infrequent, they will get delayed. or they will just be absent for months together. They could be irregular, they could also come more frequent. And nowadays, a very common symptom is having scanty periods. The flow of the periods that also decreases. That is also a very common symptom of polycystic ovarian syndrome. Next slide, please. Another symptom is an increased hair growth on the face, in the chin area or upper lips, also on the chest, abdomen, back, thumbs, or toes. This is a male pattern of hair growth, and this is because of an increase in the level of male hormones or androgens. Next slide, please. There are also acne, oily skin, and hair dandruff. This is also very commonly associated with polycystic ovarian syndrome. Next slide, please. Weight gain or obesity. Usually, the extra weight is all accumulated around the waist area. Again, a very common symptom, but then, yes, it is important to know that there is a terminology, we call it as lean PCOS. PCOS is also very common in lean and thin girls, so that is also possible. Next slide. Tail pattern baldness or thinning of the hair is again a very common symptom of polycystic ovarian syndrome. And in fact, many females come to know about this because they present to the skin clinics with a symptom of excessive hair fall or hair loss from the scalp. And when we evaluate them, we find that they are suffering from PCOD. Next slide, please. How many women are affected by PCOS? So between 1 in 10 to 1 in 20 women of childbearing age has PCOS. So prevalence could be ranging anything from 2.2% to 26%. It can occur in girls as young as 11 years old. And 50%, as I told, 50% of the women with PCOS will go undiagnosed because they might not have symptoms, or they could just take their symptoms to be normal and they would not report for evaluation. Next slide, please. So a very common question that we face from the patients is, why PCOS? Why am I getting PCOS, doctor? What is the reason? So there's no one reason as such which we have been able to find. The cause is still unknown. Most of the experts think that several factors, including your genetics, could play a role in your developing PCOS. So main underlying problem is a hormonal imbalance. As I spoke earlier, the ovaries make more androgens than normal, and that leads to a disbalance in the hormones which are being produced. And this imbalance of hormones will affect all the symptoms which appear, including the development and release of the eggs during ovulation. And hence, once ovulation does not occur, there is a problem in getting pregnant also. Next slide, please. So again, now once PCOS has occurred, what are the treatment goals? Again, treatment goals will be based on your symptoms. Some people have very mild symptoms or no symptoms at all. Some might have very severe symptoms. And then it will also depend upon whether a woman wants to become pregnant at that time or not. And then the treatment will also depend upon, as Upinder talked, we want to prevent their chances of further developing heart disease and diabetes. So the treatment includes a lot of things like lifestyle modification, birth control pills, diabetes medicines, fertility medicines, and sometimes surgery in very severe cases. Next slide, please. So we will not talk much about the medical aspect of PCOS, but yes, the lifestyle modification is the first and foremost step of management when we talk about treating polycystic ovaries. You can help manage your PCOS by eating healthy and exercising to keep your weight at a healthy level. Healthy eating tips include limiting your processed foods and foods with added sugars, adding more of whole grain products, fruits, veggies, and lean meats to your diet, regular exercise. This will help to lower the blood glucose levels and improve the body's use of insulin and normalize the hormone levels in your body. And they say that even a 10% loss in the body weight can restore a normal periods and a normal hormonal balance in your body. Next slide, please. Does PCOS put women at risk for another health problems? Yes. Upinder, when we talk of non-communicable diseases, we all know that everything stems from a sedentary lifestyle. So, sedentary lifestyle and poor eating habits, along with some dose of genetics, that is now said to be one of the most common reason why so many women, so many young girls are being diagnosed with PCOS. And these women or these girls in their adolescence, when this lifestyle continues, that the sedentary lifestyle continues, a poor eating habit, everything continues in their um, early 30s or 40s, and these women are at a very great chance of developing several serious health conditions, including life-threatening diseases. The last slide, please. These women are at a very high risk of developing diabetes, high blood pressure, heart issues, heart diseases, many cancers like breast cancer, uterine cancer, ovarian cancers, so and bone diseases, muscle related diseases. So all these problems are very common in women who are suffering from PCOD. So when we speak of incorporating lifestyle modifications, it is not only to treat a hormonal imbalance or to treat the bulky ovaries which appear on ultrasound, but it is a lifelong treatment. The medicines will not provide any cure for the disease. It's a lifestyle disease, and the lifestyle modification needs to continue for entire life, so that that risk of non-communicable diseases appearing later on in their life, that decreases. So any woman who has PCOD, one thing is a medical aspect which they can always which for which they will go to their doctors, so that the medicines will help in achieving the hormonal imbalance and taking care of the symptoms like regularizing the periods, treating the acne, treating the hair fall, or treating the excessive weight. But side by side, they have to actively participate in their treatment by their lifestyle modification. So unless they modify their lifestyle, the medicines are not going to help for a long period of time. So lifestyle modification is very, very important. So all women having PCOD should start working on their regular incorporating physical activity in their daily routine and eating healthy. We all know what eating healthy is. We have to avoid junk food, all kinds of processed foods, preserved foods, instant foods, frozen foods. All these are taken on a long term basis. They are harmful for the health. They carry less nutrition, and these things have to be avoided. Foods which are high in sugar, salts, they have to be taken less. And uh, I think we had some few more slides. Can we have the next slide? So yeah, I was speaking about the sedentary lifestyle, and they say that sitting is the new smoking. Like we all used to say that smoking has a lot of serious hazardous health hazards. So nowadays they say that prolonged sitting. Like sometimes what we do is girls tell me that okay, I went for a 40 minute walk or a 40-minute gymming, but then what are they doing the entire day? They are sitting, literally sitting the whole day for continuously for 4 to 6 hours. So that again produces a lot of health hazards and increases the risk of their developing heart diseases or diabetes or hypertension in the later life. So the idea is to incorporate small activities throughout the day rather than going for a 1 hour activity and then staying sedentary the whole day. So this is also something I wanted to tell. The next slide, please. I would I would want to encourage all the listeners who are with us today that maintaining an active lifestyle throughout the day is very, very important. And be it walk, be it gym or dance, aerobics, yoga, or whatever you are doing, so please incorporate it. Small things which you can do during the entire day, taking stairs instead of the lifts, parking your car a little farther away from your destination, just getting up at your work time rather than doing a text or a phone call. Just get up, go to your colleagues, speak to them. So small um minutes of activity incorporated throughout the day. And this is our group, Cycle Giri, and we promote cycling as a means of active lifestyle amongst the citizens of the city. And we promote cycling to work because again cycling to work will provide you that moderate level of activity of 15 to 20 minutes that you require throughout the day. So instead of using your cars, if you are staying at a distance of say 2 to 5 kilometers from your workplace, cycling is a very good form of transport that you can start using. And this is one of our rides during International Women's Day celebrations. Next slide, please. These are our right to work days. In fact, today also I am coming from Fridays are our right to work days, and all our members we gather together at a point, and then we ride in our formal dresses, and we take a city ride, and then we go to our respective workplaces on bicycles. So today was also our right to work day. So next slide, please. All our women cyclists, more and more members are joining us every day. So next slide, please. I think that's the last slide. And oh yeah, we also had RJ Minakshi with us last month. So she was also promoting some cycle giddy. So it is good to get all the girls of the city on bicycles. So the idea is to promote an active lifestyle, and especially one take-home message is that our young girls, teenagers, right from the very beginning, right from the first 10 years of life, it is very important to incorporate physical activity in the lifestyle of children and make sure that whatever they are eating healthy so that such diseases can be prevented later on in life. And PCOD and all these hormonal issues have a lot of mental health issues with children also, because um, it is like because of all these symptoms that occur, acne, weight gain, increased hair growth on the face, and then women don't have a girls don't have a control over their menstrual cycles. So all these things are in some way that creates a lot of depression or anxiety or fear in their minds, and something that can really get severe and needs a treatment on an entirely different level. So we have Dr. Ruchi with us today, and she'll be speaking on what is the link between these hormonal issues and depression in women. So over to Dr. Ruchi, and Asta, I wanted to know if we can take the questions later on.
Uh, Ma'am, can we take one or two questions, then we can have the common discussions at the later end, when the questions that would be relating to both the discussions that we have. So we have
Yes,
two questions for you, Dr. Sinana. So I think the
please.
first question is very relevant, and they're saying that how often should a woman consult a gynae? What should be the frequency of regular checkups? And also, in continuation with that, questions like, at what age a girl should start visiting a gynecologist?
Okay. So see, in the till the 20 years of age, and till a woman is sexually active. Before that, unless and until they have some any gynecological problems, there is no need to visit a gynecologist. But yes, nowadays we have a cervical cancer vaccine, which is important to be given to teenager girls. And maybe we can speak on that in some another issue in detail, in some another session in detail. So
Yes.
it is only after a woman becomes sexually active that she needs to visit her gynecologist. This could be for a regular checkup, an yearly regular checkup, or for other issues which they are facing, for any kind of other problems that they are facing regarding infections or any other pap smear. A pap smear is regularly needed uh, to as a screening tool for cervical cancer. So once a lady becomes sexually active, an annual gynec checkup is required, it is recommended. So they should start visiting, and definitely someone who has never get a pap test done, they should get at least a pap test done at the age of 35 years. So even if you are older and you have never visited your gynecologist, it is recommended that you should once visit for a routine health checkup and a routine gynecological checkup to make sure that your uterus, ovaries, and everything is fine.
Right, right. Thank you, ma'am. I think that's very useful. And, one take home message that we need to have an annual checkup done. People usually do a regular body checkup. They forget about the gynecologist visits in that when they have the regular annual body checkups. So the second question is, if a woman is having her regular periods, are there still chances that she could be suffering with PCOS or PCODs?
Yes, Upinder, it is possible. As I told you that many of the women don't have any symptoms at all. It is possible that she could be suffering from PCOD. But as such, there is no need to get an ultrasound done if she has no symptoms. There's no need to go to the doctor and find out that I have a PCOD or not. Because even if she has some appearance of, PCOD on the ultrasound, we don't really need to give her any kind of medications or change any management. The only thing is a lifestyle modification, which otherwise also everyone should be incorporating a good 1 hour exercise in the daily routine and a healthy diet. So that every woman, or in fact everyone, should be incorporating, and there is no need to go for a checkup for PCOD in case you don't have any symptoms.
Right. So thank you so much, ma'am. And now we'll be inviting our second speaker, Dr. Ruchi Gupta. She has an overall experience of 15 plus years in her field. And presently she's working as a clinical child and neuropsychologist and psychotherapist in Psychiatry and De-Addiction Center and Neurosurgery Departments of Mayo Hospital, Mohali. Currently, she's conducting child and parental guidance, adolescents and women clinical sessions for various psychological aspects at Chaitanya Hospital, Healing Hospital, and Health Square. So over to you, ma'am, and let's throw some light on the second most shun under the carpet topic, and that is depression. And let's try to bring the both topics together by the end of the session. So over to you, ma'am. Thank you.
Okay. Thank you so much. Thank you so much for making me participate into this activity. Thank you for Dr. Sunanda and the whole GSA team for including me into these things. And this is really a wonderful part to deal with, because women and mental health is basically a very big topic where we need to work on to. So can you just put on the slides? Yeah. Next slide. Yeah. So, in this, mental disorders can affect women and men differently. There are almost certain types of disorders that are unique type of disorders that are specifically for women. For example, some women may experience symptoms of mental disorders at the time of, as Dr. Sunana said, that hormonal changes are there. So there are so many hormonal changes which is coming forward, and one of them, you can say that there is a polycystic ovary syndrome. And I have been going through so many others like perinatal depression, premenstrual dysphoric disorders, perimenopausal related depressions. So these all are a different part where women are these days quite facing, because women these days are more aggressive and more into the field and other activities. So we have to consider about the depression part specifically, as Dr. Sunaina and all say that the percentage of depression and mental health issues are coming more into the females and the women part, and it starts during the, you can say, adolescence phase only. So let us see forward. Second slide. This again mental health and women basically. Third slide. PCOS and depression in women. So see here, the slide is that PCOS and depression in women is basically, it is representing that, which I wanted to say, that I myself has faced lots of challenges in life. Being woman is not an easy task these days. It needs a strength and courage, but courage in both the areas like personal and professional life. So PCOS self is known to cause a stress. This stress can lead to anxiety and depression. PCOS and depression often go together. Next slide, please. As Dr. Sunana has already said, that it has hormonal differentiation. So high cortisol also increase the risk of insulin resistance, which in turn can cause depression in PCOS women. If you have PCOS and depression, getting help for both the conditions is important. With treatment, you can greatly reduce the symptoms of both the conditions. And it has been prominently noticed, as I've been working into the field with the women's health for a long time. I have seen women who are suffering from this thing, but they are hesitating to come forward. Specifically, there is a myth that depression is there or anxiety is there, and they are not coming forward directly until unless they have been spoken by their gynecologist to go and have a talk. with the specialized person and take the therapy sessions, which we say psychotherapy sessions. So this is one of the important part which I would like to tell every females, whoever is listening here, that don't go with the hesitations or the myths, because the more you will go for the mental health of yours, the more physically fit you will be. As Dr. Sunana said, that physical fitness is very important, and your diet and nutrition is very important. So this all thing is basically connected. How you think, your own mental health is very important, and every single woman has to give the priority for their own mental health. Then only you can reach to your own prominent physical health. So next slide, the treatment psychotherapy part. So means one can share this her feelings, thoughts, and fears, because there are so many fears related to your PCOS or any specific problems you are coming to and facing. So there are different therapies where your anxieties, depressions, or any thoughts relating to it can cause mental stresses. So there are basically main three parts, and the main important part is the cognitive behavior therapy, which helps identify and change negative thinking patterns and teaches you coping strategies. This is the most common type of therapy. Second comes is the interpersonal therapy, which is focusing on improving problems in your personal relationships and your own self. Third is your psychodynamic therapy, which is based in recognizing and understanding negative patterns of behavior that come from the past experiences and working to resolve them. The next slide, please. In general, you can say that again the three component interventions required in PCOS is basically, you can say that diet, exercise, and you can say that cognitive behavior therapy, which is more effective in the long term to improve your emotional well-being among women and adolescents, girls. Next slide. Cognitive behavior therapy and PCOS. Cognitive behavior therapy helps in improving the quality of life and psychological fatigue in the women with polycystic syndromes. Cognitive behavioral therapy improves the weight loss and quality of life in women with polycystic ovary syndrome. So, cognitive behavior therapy is a really good therapy where your so many things are improved, because you say that you want to do the weight loss, you are doing the weight loss, physical weight loss, you are trying, you are exercising and doing everything, but mentally, if you are anxious too much, or you feel low about it and you have to just do because your doctor has said to do it, this is a basic problem where you don't really lose it. So this is the important part where the cognitive behavioral therapy really helps you to improve your weight loss and your quality life also. Next slide. Yeah, continuation with this, it also helps in identifying the negative cognitive distortions, review your body image diary, and review sleep and developing a healthy body image and self esteem. Applying the problems, solving approaches to illness, coping and lifestyle barriers, assess impact of your sleep disturbances. Other psychotherapies with CBT also helps in showing positive self and developing talents. As Dr. Sunina has said, that your body, your weight loss, your physique, everything matters a lot. So body image development is very important, where you feel positive about your own body and how healthy you're feeling about yourself. So this is one of the important part, and reassessing your lifestyle goals. As Dr. Sunana has also said, that lifestyle goals and lifestyle changes are very important. Staying motivated to keep on working again and again. Secondly, it is like increasing your physical activity, as Dr. Sunana has said. It Your CBT also helps into increasing your physical activity, everyday lifestyle movement, and decreasing sedentary behavior, again, which Dr. Sunana has pointed. So, this sedentary behavior you have to reduce, because all the time sitting to one place is a difficult thing for you to manage it. Please, next slide. Your cognitive therapies also helps in developing social problem solving skills, positive view towards your own illness, and how to accept as part of you and keep going. in spite of feeling helpless. Modifying your negative cognitive distortions and attributions regarding health, emotions, and physical self. Incorporation of lifestyle changes, dealing with anxiety, overthinking, helplessness also, it helps into all these areas. Developing social problem solving skills, resetting lifestyle goals, that is again nutrition and exercises, avoiding sneaking eating, and physiological and psychological hungers. So you have to understand what is your psychological and physiological hunger. Similarly, you have to develop your problem solving skills. Like you have got so many problems, so much overthinking is going on into your mind related to PCOS, because you feel that it is the biggest problem. So how it helps you to practice into your positive reframing, using your thoughts, your social support, review of skills, staying on track and avoiding making lapses turn into relapses. Because once you are working onto yourself, you feel happy, but then somewhere if you're not practicing the things into your mind, then you can see that there is a chance of relapse. Relapse means that you will start going back to the same eating because the craving of food and other things still is inside you. So how to balance that thing mentally is also very important, because again if you relapse, the depression coming forward is into a double level. Please next slide. This is my last slide, where the family of that person who is going through these problems is like psychoeducation about the expressed emotions. At least females should be able to express these emotions and discuss these things between their own adolescents. Wife should can discuss with the husband, daughters, and parents also, or the partners, about the progress and the problems. So this is the important part where the therapy really works. Uh, this is what I would like to suggest, and I'm open for the questions. So please go forward with it.
Thank you, Dr. Ruchi, for that enlightening session. So we have one direct question for you, and then we have a common question for both of you. So I'll go with the direct question that is there for you, and I think it's a very interesting question. So you spoke about therapy, and one of these speakers have a question that if therapy suggested to a woman who's suffering from depression, is it useful that it should be just only her kind of suggested for therapy, or should the family also kind of be there for the
Yeah,
session so that they could be more
yes, yes.
supportive?
Yeah, the last part, what I said about the family is the basic part which you have to understand. The family has to be supportive what the person is going through. So that is a very, very important part, and the family plays a very important role when a woman is going through PCOS and depression together, and they have to need to understand whether it is husband, whether it is your parents, or whether it is your fiance or anybody. So yes, they have to be a participative person when the person is going through therapies, because they have to be also counseled about and talked about their mood changes, because in depression there are frequent mood changes. You feel low suddenly, sometimes you feel so anxious about the thing. So definitely it is a supportive therapy where the family members has to participate, and it is an important part in the therapy that few minutes have to be given and guided to the family members, definitely. Upinder, your voice, yeah.
I forgot to unmute myself. So yeah, the next question was actually directed to Dr. Serena, but I think this question should be asked to both of you. For Dr. Serena's part, I think the question is PCOS curable? And I think my question would be, is depression 100% curable? Because we see so many relapses, and when I personally speak to women who are suffering from depression, one thing that they have in mind is, this is something which will go itself, or at times, they say this is something that's going to stay with us forever, no matter how many medicines we take. And if we take the medication, it's going to come back again. So, yeah, so it's going to be in parts. Are both these problems independently 100% curable? So I think first Dr. Serena
Dr.
can go.
Sunana,
The question was
yeah.
directed to her.
Yeah, yeah. I'll first take PCOS. Upinder, as I told earlier, PCOS is a lifestyle disease. It's just like, you can say, it's just like diabetes. So it is not something that would be completely curable just with the help of medications. But yes, if someone has incorporated lifestyle modifications early in the onset of disease, and they are continuously working on incorporating those lifestyle changes, including a good amount of physical workout and a healthy diet, the disease symptoms will stay suppressed. The ultrasound might turn out to be completely normal. But yes, if they again turn back to their previous or an unhealthy lifestyle, the disease would again crop up, because these are hormones which are being produced every day in a new way. So when the body is not following a good lifestyle, the hormones would again start getting produced in an imbalanced way, and again PCOD will crop up. So it is all about how you are managing your body and your diet and your mental and physical health. So it could be curable for some people with a good lifestyle change, and for some it would stay incurable even with the best of the medications.
Yeah.
I always
So
forget to
here
unmute
I've
myself.
already,
So I think it's a permanent lifestyle change that
yeah.
that could help us to, kind of permanently be free from the symptoms of PCOS. So yeah, over to Dr. Ruchi for her inputs about it.
Uh, yeah, the depression, you can say that it can be 100% treated. It works onto your thought process. That is where the cognitive behavior therapy works onto depression and your anxiety. As I have already put a point, that you have to keep on practicing the positive reframing using your thoughts about the problems. The more you think negative about it, the more anxious you are, the more you have the chance of relapses. So you have to go with the three things. मैंने पहले भी I have really said it, that your eating patterns, your own dietary, your own physical activities, and third is how is your mental state, which is very important. So avoiding making lapses to turn into relapses, that is the part where the cognitive behavior therapy, where the therapist helps you how to work onto it, and you have to keep on working, because it is basically a learning process and it is a coping strategy which you have to learn again and again, and then you will be able to have to accept it into your lifestyle process, lifestyle changes. So why we keep it as a lifestyle changes? Because lifestyle changes is for a long time, so you have to keep on working onto yourself so you can stay on track forever. As Dr. Sunana also said, that PCOS is like, it can reoccur. Depression can only reoccur if you do not work onto your thought process. The more you will work onto your own thought process and you are positive and you're accepting that it is a part of you, not the whole of you, so you shouldn't be depressed about it. As if diabetes is a part of it, you say that you accept diabetes. The same thing, if you say that PCOS is a part of you, not the whole of you, you're accepting your illness actually, and where the CBD helps you how to accept it. So similarly, relapses only can happen if you're not accepting it and you're not practicing your own positive thoughts actually, which is very important.
Right. Thank you, ma'am. So we have two more questions. So I'll go with the first question, and either of you can answer that question. So somebody has written that, 10 years back, there was no PCOS, and even we never heard about anyone facing depression. All of a sudden, we hear people saying, I'm depressed, and people being diagnosed with PCOS. So I think the speaker really wants to need, what the change has come in 10 years that, all these things have become so common. So either of you, the floor is on you. Either of you or both of you can answer
Dr.
this.
Sunana, you can go forward.
I'll speak about PCOS and then you can speak why depression is so common nowadays. So, Upinder, I think we all know, this westernization of lifestyle that is coming up
Yeah.
nowadays. And more and like when we were children, I hope you all will agree with me. We used to be, we used to be out all the day from our homes, and we used to be playing out in the streets and all. So nowadays, it is very uncommon to see young children playing out in the parks or the streets,
Yeah.
people children are glued to their, gadgets, the mobiles, tablets, TVs. And on the top of it, the, the plethora of the junk foods that are available nowadays. And in the earlier days, we never had this option of eating, ये खा लो या वो खा लो. एक ही चीज होती थी, घर पे बनती थी, सब लोग वही खाते थे. बट आजकल तो बहुत सारी ऑप्शंस है, एंड parents don't have time for children, and they somehow feel that by giving these pizzas, pastas, burgers to kids and then taking them out, or that's their way of showing affection and love for the children. So somehow children are also getting hooked to such kind of eating habits. So everything is a culprit. That's why PCOD like things, they are growing up, and that is the reason for a high incidence of non-communicable diseases also. And they
Yes.
cropping up at a very young age. पहले 40s 50s में जाकर डायबिटीज, हाइपरटेंशन ये सब होता था. आज तो इट इज सो कॉमन इन अर्ली 30s, very common.
So
That's
I
the
think
only reason.
we all have to put that reverse gear again and go back to the lifestyle
Yeah.
that we all used to have.
Yes.
Yeah, Dr. Ruchi, would you like to add on to that?
Yeah, I would like to add on to this thing. Why depression is getting common these days is because, as Dr. Sunana has said, that in the older times when we were small, we used to go out, we used to play, and we used to do so many things, physical activities, and we were not bothered about anything. So our parents made us used to one point is the frustration tolerance. If you are not getting anything, it hardly matters. And they made us more emotionally strong than emotionally sensitive. These days parents, both the parents are working so much, and they are wrongly pampering somewhere their kids, that because of their own might be guilt feeling, and because of that the child is not able to grow strong, and they are not developing the frustration tolerance which is required from a very younger age. So with small little things, I have been seeing there are so many kids who say that they are going through depression, through anxiety, different symptoms, fatigueness, and all these things. Especially in adolescence, I have been noticing these depression symptoms are going so high, and sometimes you can see the suicidal attempts also going through, and frustration is so high within them. So this is one of the cause that. Where the depression at present moment, as you can see that western culture is have overtaken. So does our thought have multiplied to go forward? The western culture, if you will notice, every single person who is going through any stress, they go forward to meet their therapist or the counselor to sort it out. Here, you know why it increases, because they don't go, because there is a myth again to go to a psychologist or a psychiatrist. We are not mad. So my again will be there to open up your mind to these things, that even if you are going through certain problems, even if your thoughts is basically what you start thinking when you are a teenagers, from your 12 or 13 years of your age. If you see changes in your kids at this age, it is really really essential to bring out, and parents are bringing, but they're bringing when the things are too chronic. Fine. So I think so. Okay, this part is being left by the parents, because parents think that they are doing their best. But still, I feel that parental guidance is also required, so that they can grow their child in a very good level. And this phases of depression should not be a myth, and it is not like that. It is not curable. It is definitely curable, but you have to keep on working onto your thought process.
So thank you, ma'am. So I think again it boils down to the things that we need to normalize all this, and we need to start the discussion and talk about it more frequently. So
Yes,
we have
yes.
two more direct questions, and then we'll end the session with an experience of a beautiful girl who's working with us and GSA, and you know how she has fought with PCOS and came out of it very bravely. So I think the one question is directed to Dr. Sinana. She wants to know that do older women do face problem of PCOS, or it is just the disease of the young girls?
No, Pinder, PCOD can crop up at any stage of life. Uh, it is not a disease of the young girls. Many women in their reproductive age group, after they have completed their families, even they face PCOD problem. So it is common in all age groups of reproductive aged women. Young girls are more frequently coming up with PCOD because all these lifestyle changes, as we talked about, they are now manifesting earlier in life as compared to people in their 30s and 40s who have had a healthy lifestyle throughout their younger childhood. They have eaten well and they were more physically active. So those people have lesser incidence of PCOD as compared to the young girls of today, who in whom the incidence is very high. So it can happen at any age.
Right, ma'am. Thank you. And for last question for Dr. Ruchi, any self therapy tips for women suffering from depression?
First important tip for this thing is that you should always accept the problem which is coming forward, and there will always be a problem solving skills. So you have to focus on to the solutions of the problems, not to keep on repeating the problems inside your mind. And if you are not able to do it, then it is better to go to a therapist to get little few sessions so that you understand how you can really deal with your own thought process, because most of the time a negative thought patterns develop, which sometimes you are not able to go through it and you're not able to reframe your thought process, where the therapist will definitely help you how to reframe in a positive way, and you can really live a very good healthy life, definitely.
Right.
So
Thank you
yeah.
so much, ma'am. And I have one last question for both of you. So, because and that question is from my side. So we all have spoken about how important both these topics are and how they are now hugely affecting women of our country. So, what according to you, because you are there in that healthcare system, what according to you should the government take step to kind of promote this topic more? Because even now PCOS doesn't come under the NCD umbrella of the government programs, right? Neither does depression. Yes, there is a mental health program running, but I personally don't know how differently they're catering to women, because it affects women in a complete different manner as it affects men. So what according to you should the government kind of focus on, or maybe come up with that you know so yeah, like what could be the takeaway message for the governments from this webinar, like what we as women demand from them?
ओके उपिंदर, मैं तो सबसे पहले यही कहना चाहूंगी कि सबसे पहले तो ये
I think we lost Dr. Sinana. You'll have to start over again, because I think we lost you in
Yeah.
between.
am I audible?
Yes.
या
Yes.
उपिंदर, सबसे पहले तो ये पर्सनल रिस्पॉन्सिबिलिटी है फॉर ourselves and for our children, that we incorporate that healthy lifestyle amongst the family. As you earlier spoke about कि बहुत सारे women को preventive health care accessible नहीं है. So I think that is true for so many other diseases. But as far as preventing non-communicable diseases is concerned, so that lifestyle, that healthy lifestyle that needs to be incorporated, I think women should come forward and take that responsibility. First of all, they should be educated. They should be aware of the ill health and the health hazards of a sedentary lifestyle, of the foods that their kids are eating, and then they should take that responsibility for taking care of themselves as well as their whole family, because a woman is the center of we will decide what the whole family is going to eat in the day. So we can take that responsibility and educate our children about it. As far as governments are concerned, I think we can. There are a lot many things that need to be done in terms of incorporating this. This thing should start early. The lifestyle changes or the lifestyle attitudes that need to be made, they should be started very early in life. So अगर आजकल हम बच्चों के बाहर खेलने की बात करें, फिजिकल एक्टिविटी की बात करें, so I think still the spaces for safe spaces for children to play, to cycle, to ride, or to walk, they are still not there. So आप अगर मैं अपने मोहाली सिटी की बात करूं, so there are a lot of parks, say for instance, lot of parks, huge green spaces which are open for walking to public or for jogging tracks हैं. But अगर मैं आज बात करूं, my 10-year-old daughter, she wants to ride. I don't have a single place where she can, you know, take her bicycle and she can learn riding, or she can ride for, you know, a 15-20 minutes ride safely, where there is no uh, fear of motor traffics. So we need to have safer places where children can go and just enjoy, be physically active. Parks और ज़्यादा होने चाहिए. And they have installed gyms and all in the various parks, but I think their upkeep is not well and they are not children friendly. So we need to have more children friendly places. And secondly, I wanted to speak to you about if we can incorporate some weekly Sunday sessions where families can interact together. I think this has to come up from the government. As you know, as citizens, we can, you know, we can participate, or we can just encourage other people to join in. But the effort, if it is a prolonged effort, it has to come from the government. We can have some, you know, places which are restricted to motor vehicles, and families can come out and they can enjoy their day. Children can safely, children, senior citizen, everyone can safely, you know, walk or cycle or whatever. So these things are the need of the hour, and the governments have to come forward to incorporate such plans in the city. It makes a smart city plus the smart citizens. So it is very important.
Smart and healthy citizens.
Yeah.
Over to Dr. Ruchi.
Yeah, about the point about the mental issues, mental health issues, and depression coming into the kids is the basic thing. If you inculcate if you are getting your counselors trained, because I have seen there are so many government schools and colleges and all the places, they don't have a proper counselors or psychologists who are really trained for these things. So government should have some training centers where at least you have got certain counselors or certain psychologists who are specifically trained about the mental health issues into the children, and how it can be really be notified and worked on to the school levels. Because I have been going to certain schools, there is no education to the teachers also about the mental health issues or the behavioral issues coming into the children, where they are the basic future of our country. So my important part is that that training properly has to be given to certain counselors, and government should see to it that every school should have that proper psychologist or counselor who can really understand these problems and can forward them to the specialized people where these things can be worked out. So even the one suggestion is there that you can always have a parental guidance this thing issues to be sorted out and to be worked out into the schools, and into the there are so many NGOs also who are working, but I feel that those NGOs should come forward more openly for working on to different government schools and other areas, so that it can come forward in a presentable way. So this is my basic suggestions, that the childhood, जो बचपना है, वो बचपन जो है हमारा है, वो जितना strong रहेगा और जितना psychologically strong रहेगा, उतना ही I think so the state or the country will get to the females also. And I would like कि yes, इसमें सिर्फ females को ही नहीं guide करना है, इसमें males को भी guide करना, that how much you can be a really help when you can see a female or any girl having any complications. So they should also be trained onto those areas, because sometimes they are not able to understand what the mood changes or the things the female or a girl child is also going through. So these type of small trainings which the government should take the initiative, where both can be trained, not only the females but also the guys, but also the boys has to be trained onto these areas, where they could respect about these things into the growing stages of the girls and the females. So that would be my suggestion and my view for the government part, that they should inculcate these things from the starting into the government schools and specifically into the private sectors. Because if you see, in government schools there are so many people who are coming from outer side, fine, from very basic schools, like very you can say mediocre families, where these things the parents are not able to understand. So this is a right stage where you can really guide these younger generations how to cope up with these things. So that will be my suggestion.
Right. I think one thing that I can promise from my side is like we will at least start try to incorporate these suggestions in our city. We can, collectively start demanding for it, and sooner or later, I think we will be able to gain that space and gain that importance onto all those topics. So, and I'll get in touch with both of you apart from this session to how to take it forward to actually, create that environment wherein people are motivated to bring about those lifestyle changes in themselves. So thank you so much. Thank you so much, Dr. Serena, Dr. Ruchi. You've taken out time from your busy schedules. We know that, during this time, how important both of your roles are, because the children who are being born, giving them a safe environment to come to this world, and the mental stress that this COVID and lockdown has brought in. So I think both of you have a very important role to play in these times. And we'll close this session with a positive note, wherein I would just read out the experience of Gurpreet Patti. She's also heading our youth chapter at GSA. So she suffered from PCOS, and I myself have seen so much positive and beautiful changes in her, because once she was diagnosed with it, she knew what the problem is with her body, and how she's kind of bringing those lifestyle changes and bringing in that discipline in her life. I really look up to her for that. So I'll just read out what exactly she has written for us. So she says that this session was incredibly informative and has addressed so many issues that someone struggling with PCOS might face. I myself have struggled with PCOS since the age of 15, but unfortunately didn't understand how to exactly deal with it. The lack of information and sometimes the generalization that is associated with PCOS doesn't really help. Having reserved PCOS now, Having reversed PCOS now, what I have really understood is that you have to be kind to your body first and foremost. Take into account the fact that you that your old lifestyle just won't do. Dairy and gluten aren't your friends. Start with walking for just 10 minutes a day and take into account your mental health. Be patient with yourself.
Yes,
So I think
true.
that's so beautifully summed up our entire session
Yeah,
in
that's
that
true.
in that few lines. So thank you so
That's
much.
definitely true.
And I really hope that we stay connected so that this discussion in this webinar doesn't end here, and we are actually able to bring out some positive change for the people of the city, at least to start off with. We'll start with one city, one step at a time, and let's see from where this partnership that established today goes forward. So thank you so much, Dr. Sanena and Dr. Ruchi, and keep doing the good work that both of you are doing. Thank you so much.
Thank you.
Thank
Thank you
you,
so
Upinder.
much.
It was a
And I
wonderful
thanks
Thank
all
you.
the audience who've been with us, and who've given us such beautiful questions to make this discussion even more enriching. So thank you so much, everybody, and we'll be back with our more videos and webinars soon. Thank you. Thank you so much.
Thank you. Thank you so much, everybody.